People, I need to inform you. Now you see why I healing myself. I meet a man last week that have been used from doctor, from fat liver, and remove his liver 50% and heart operated. That is so incredible. I have done everything in a naturally way. And what Robert F. Kennedy will do in the government, he will use the right people to not write out medicine, but make people healthy again. And I give you the proof here. The two very professional doctors talking about him. You listen, people. That is so incredible.
And I know he is committed to freedom.
I'm so happy I find this for you.
Just like RFK Jr., just like all the other people President Trump is putting up. And I have total confidence in President Trump and the people he's selecting for these key positions.
Well, it sounded like John Thune was going to play ball. That's kind of what I read between the lines earlier tonight, but we shall see. Congressman, thank you very much. All right, just ahead, why RFK Jr.'s nomination has the medical induct pharma and Anthony Fauci, Francis Collins, probably won't be sleeping particularly well tonight, because it turns out that when Trump said he was going to nominate RFK Jr., floating the possibility to head up HHS, he was serious.
Robert F. Kennedy cares more about human beings and health and the environment than anybody. I'm going to let him go wild on health. I'm going to let him go wild on the food. I'm going to let him go wild on medicines.
Oh, my God, that's terrified everybody. But will RFK really be able to make America healthy again, given the bureaucratic behemoth he's going to preside over at HHS? And it's one of the largest departments in the government, with a budget of over $3 trillion, obviously as Medicare, Medicaid. That's 22% or so of the entire U.S. federal budget. And the department has 14 sub-agencies, then also, of course, the CDC, the NIH, the FDA. RFK Jr. has promised to clear out entire departments for reasons like this.
We have 1,000 ingredients in our foods that are illegal in Italy and other countries in Europe. And the reason for that is corruption. At the food industry and the agriculture, big agricultural producers control FDA. And so they're not worried about public health. They're worried about advancing the mercantile interests of those corporations.
Well, there are a lot of people out there who don't really want to wade into the substantive issues that he's raising. So I'd expect nothing but smears leading up to his confirmation hearing.
The former president promised America the very best. With respect to Robert F. Kennedy Jr. and others, is this America's very best to safeguard the health and well-being of the American people? Of course it's not. He's completely and totally unqualified.
This man is criminal.
Folks with a serious
He's
background
going after the book
and serious
to make
expertise.
American people more
Robert
sick.
F. Kennedy Jr. is, of course, none of the
He's a
above.
criminal bastard. No, we're
He's
talking.
the future Democratic
Listen
leader
to
by 2028,
these doctors.
King Jeffries. Joining us now, Dr. Mark Siegel, Fox News medical contributor and NYU Langone professor of medicine, and Dr. Peter McCullough, internist and cardiologist extraordinaire. Dr. Siegel, let's start with you. Okay, so we have this crisis in our food supply in this country. That's going to be a major focus of RFK's. In the United States, we have 42, almost 43% of adults now qualifying as obese. So what reforms do you expect from him, maybe about school lunches or other federally subsidized foods, can you expect to maybe try to reverse some of this obesity epidemic?
I think he's starting in the right place, Laura, because the F in FDA is supposed to be food, right? But we have a sick care system, not a health care system. And by the time you get to those medicines you take, or you're seeing me for obesity or for high blood pressure or sleep apnea or diabetes, it's because you were loaded up with those ultra-processed foods. 73% of all the food on our supermarket shelves, ultra-processed. Salt, sugar, high fructose corn syrup, chemicals that are unregulated by the FDA. And by the way, one of your favorite things, The FDA is working from home. They're not even in the office. They're working remotely from home. You know, 20 years ago, I was on RFK Jr.'s show, Ring of Fire, repeatedly. He was an excellent host, very incisive, very smart, very bold. And so I'm hoping, and I know he's going to start with this issue of food. And the other issue that's related to that is the great technological advances we have, and I'm sure Peter's going to agree with this, they're great. But when they get to phase 3 trials, they're already bought up by big pharma. And guess what that lobby does? They pressure the FDA to approve everything. That's the cronyism that he's going to look into.
Well, and Dr. McCullough, I mean, I don't know how many times you came on the angle during the first really 2 or 3 years of COVID, and that in and of itself demonstrated the corruption in the U.S. medical industrial complex, did it not?
We saw widespread corruption, malfeasance sweep in through the agencies. You know, they were all overseen by current Secretary Xavier Becerra, who in many ways was a quiet dictator. Kennedy is going to be such a contrast. He's certainly not quiet, and I think he's going to be egalitarian. I agree with Mark, starting with food. He's interested, I think truly interested, as Trump said, in the well-being of Americans. So as he works through these issues of data transparency and accountability, I think we're going to see sweeping changes in healthcare administration.
And Laura, think of how much...
Getting rid of the crony... Go ahead.
Look, think of how much money we save if we get on a treadmill or if we eat healthy food, you know, produce or school lunches, like you said, versus getting obese, getting high blood pressure, getting heart disease and cancer. Insurance companies love that, right? Because then they can suck in higher premiums. That's the unhealthy healthcare system we have.
Yeah, the massive rise in colorectal cancer among young people. Studies I know, I think at Georgetown and other places, linking that to processed food eating by young people and energy drinks. Yet the media, Dr. McCullough, will stick to this RFK is anti-vax attack, but he says he's not. Watch.
I've never been anti-vaccine.
You will not take any vaccine that is currently on the market.
I'm not. If vaccines are working for somebody, I'm not going to take them away. People ought to have choice, and that choice ought to be informed by the best information.
Dr. McCullough, your reaction to that? He says he's not going to take vaccines away. It should be a pro-choice issue.
You know, I know RFK personally. I know he's taken plenty of vaccines, as I have. It's not an issue of taking away people's vaccines. It's about a personal choice and actually safety of the products. RFK is going to have a range that's going to be much far greater than vaccines. We're talking about drug safety, ending corruption with foundations and with big pharma. I think we're going to see a total overhaul of healthcare administration.
The only thing I'm not in favor of, I think that he is so far, is psychedelics, legalizing those. No can do that.
More
but,
study.
Dr. Siegel, and yes, thank you, Dr. Siegel. We're on the same page. All right, both of you, thank you very much, Dr. Siegel and Dr. McCullough. All right, coming up, a liberal host just admitted that
People, please send this to every people you know, because here we see what the criminal people have done. With COVID and the pandemic, everything is about money. That is incredible. I'm so happy I find this for you. Have a really good day, people. Take care.